Hi ED, and welcome to the new process for sepsis with the introduction of the Sepsis Tool Kit. Meditech has some features that will help us to early identify sepsis and get into action. So let me show you what that will look like. Let's quick go over the adult sepsis screening. We go by 3 levels. The first level being any suspected or documented infection, which can be any invasive procedure or surgery, cough, shortness of breath, abdominal pain, purulent wound drain, fever, chills, cellulitis, central line, or any antibiotic that's not prophylactic. In addition to that, you'll need 2 or more search criteria, which is your level 2, any temperature over 101 or under 96.8, or a recent fever, a pulse rate over 90, a respiratory rate over 20. If you have 2 of those, that will trigger a possible sepsis risk. And then in addition to that, if you have any organ dysfunction or any criteria in level 3, this will trigger a possible severe sepsis risk. So you'll need a systolic blood pressure under 90 or an MAP under 65, new or unexplained change in mental status. We don't do bedside lactics, but if it was above 2, that would trigger that. Or a acute respiratory failure or intubation. So our sepsis screening is going to now be added in a couple different places so that we can better identify sepsis much earlier. Certain chief complaints have had the required assessments for sepsis for anybody over 17 years old, but now these assessments are going to have the sepsis question: altered mental status, abdominal pain, dizziness, fever, general adult, headache, nausea, vomiting, diarrhea, neuro symptoms, short of breath, seizures, skin, abscess, foreign body, syncope, upper respiratory infection, urogenital, male and female, and weakness. The sepsis screen will show a no definite risk until the sepsis criteria is met. When no definite risk is displayed, the action taken by the nurse is going to always default to no action required. The sepsis screening results is determined according to the possible criteria of infection. So number 1 being a suspected infection plus 2 or more search criteria. This will display possible sepsis risk. In addition, if a patient also exhibits 1 or more signs of organ dysfunction, the patient screens positive for possible sepsis risk. And once this happens, you will get the following pop-up. The sepsis algorithm is adjusted for the ED to account for the fact that labs are not available when the patient first arrives. So as you see here, the sepsis screen field will change to sepsis risk or possible severe sepsis risk, depending on the answers. In those circumstances, the field action taken by nurse becomes required. When provider notified is clicked, the sepsis name of the provider will also be required. The provider notified is a lookup in the provider dictionary and will not accept a free text. So just like we're used to seeing on the tracker now displays the following responses: the responses to the sepsis screen queries and the sepsis indicator flag. So as soon as we know that we have a sepsis patient and we tell the provider, ideally they're going to put in all the orders for sepsis, but in the event that there's a delay, the nurses will have the ability to click on that sepsis icon and the little flag, and it'll bring you to the order set for sepsis. So the new part of the process is that the nurse will initiate the sepsis order sets called ED Sepsis Screen Tier 2. By clicking on the indicator flag, the order set must be used to trigger the sepsis functionality, so do not order them individually. Click on the order set words. Clicking on the words brings you to the order screen, and you'll complete the provider and source and click OK in the bottom right footer section of the screen. Once you get to the order set, you will see that they're all pre-checked, and you'll have to answer the red edit for the blood cultures and make it a stat. You'll also notice at the top of the screen the associated data shows up, which is any of your out of range vital signs that triggered the sepsis screen. Once you click that, it will trigger a reflex for a blood culture, and this is your blood culture number 2. So just click on the red edit there and make it a stat. Then you will see the list of orders displayed for final review. They have not yet been saved, which is indicated by the green print on the status column. Once you save that, a reflex order for the second lactic acid level is created in the laboratory. You will not see it on the orders list since it does not become active unless the result of a lactic acid is over 2.0. If the lactic acid results greater than 2, the order will activate 3 hours from the time of the result and will create a stat indicator on the tracker. The stat indicator under new orders will display on the nurse's tracker. This will take away needing to cancel or reorder a lactic acid depending on the level of the first lactic acid. Now, when we use this order set, one of the new things that it will require is for us to acknowledge the orders. So as soon as you put in the orders, it'll bring you to this acknowledgement screen, and you click on acknowledge, and that will activate all of the orders, and then you will see them as activated in your tracker under the orders. There will be 2 new assessments on the work list. The first one is the ED triage quick assessment with sepsis screen, which is done at triage. The sepsis screen is to be used on all subsequent documentation at least every 8 hours.